Let's go over the shoulder. So it's one of those areas of the body where I feel like once you understand how things integrate together, and again, anatomy is really hard. So all of this, there's still a lot more nuance to the shoulder girdle, the shoulder joint, but hopefully this helps to give some perspective to break down some of this into manageable chunks so that you can understand the shoulder a little bit more. So let's first go over the shoulder girdle. I'm actually gonna remove some of these things on one side of the body so we can get to the bones. And again, if you haven't saw the back muscle video, then go check that out. I'll provide a link below. So traps, let's hide that, right? You're going to have, I'm gonna get rid of all of the muscular layer on this side so we can kind of see and appreciate the bone. So post delt, mid delt, and front delt, they kind of really did a good job to differentiate it here. It does not look like that in a body, but they just made it all one deltoid muscle. So that's kind of interesting. Then you have the rotator cuff, right? You have supraspinatus here. I'll break down this in a little while. Infraspinatus here. Then you have teres. This is teres major, and this is teres minor. That is an external rotator that supports the rotator cuff. And then let's get rid of triceps. Okay, so actually let's get rid of lats too. And then you can kind of see, I'm gonna remove all of this, biceps. Let's remove pec. Let's remove the humerus so that we can kind of see and appreciate. This is your glenoid labrum or joint capsule, and actually this is your labrum, right? Articular cartilage. These are just your posterior glenohumeral ligament, inferior glenohumeral ligaments, anterior glenohumeral ligaments. Let's get rid of this. You even have your subacromial bursa here. Okay, hide that. Subdeltoid bursa floating in space. This is your biceps tendon or intertubercular tendon sheath because we removed the bicep. Let's get rid of all of this. Okay, these floating things. Okay, so the one thing that I want to appreciate here, let's get rid of platysma. Okay, the only connection of your shoulder girdle back to your axial skeleton is your sternoclavicular joint, connecting the sternum to your clavicle. So this is your sternoclavicular joint, or commonly referred to as your SC joint. Then you have your clavicle, or in layman's terms, your collarbone. And then you have your AC joint, which is your acromioclavicular joint. Your acromion is part of your scapula, your clavicular is obviously your clavicle, and this makes up your AC joint or acromioclavicular joint. So this is your spine of the scap here that extends into this bony landmark called your acromion process. So the key things that I want to go over here is that your scapula, it sits tilted towards the anterior side, or it sits tilted forward in the frontal plane. It's not perfectly in a straight line, right? And we can see that if I move this model, right? If I look from the top view, you can see that it's not in a straight line across here. It is going at this angle, right? So that's your scapula. Because it is sitting on top of your rib cage, again, there's no ligamentous connection or passive support. It relies purely on dynamic stability, which means that muscles are holding your scapula against your rib cage or connecting from your scapula to your spine, and that is how our scapula is very mobile to move in all these different ranges of motion, but also it relies on this muscular support for stability. So that is the first thing that I wanted to go over. It actually sits about 30 to 45 degrees forward of the frontal plane, which we just saw, and also if we look from this aspect, the scapula is actually tilted. This top part is more forward than the inferior border or bottom part of your scapula. And it's actually tilted about 20 degrees anteriorly. This top part is 20 degrees forward compared to the bottom part. So it's not purely sitting in what we intuitively think as like a straight line or in a single plane. It is slightly rotated, and that's the resting position of your scapula. Obviously with movement, it's going to change, and our scapula can tilt in various ways, can upwardly rotate, downwardly rotate, can protract and retract, but for the most part, in our neutral position, that is the resting position of the scapula. Now, why that is important is because that will kind of give some perspective when we talk about function of various muscles, and especially why we need to have a stable shoulder blade or scapula to make sure that our muscles actually work in ways that it's meant to work. Okay, and the last thing, actually, why don't I get rid of, this is your subscap right here, part of your rotator cuff. Let's get rid of that. Actually, this might be a pretty good angle. This is your serratus anterior, and it is sitting between your ribs and the scapula, and it's going underneath or on the anterior surface of the scapula, and then it attaches to that medial border of the scapula. And again, it helps to protract, helps to upwardly rotate our scapula, but it also prevents the scapula from winging, right? And you've seen that if people have poor scapular stability, that in conjunction with the rhomboids, where I briefly talked about this in the back muscle video, but the serratus anterior and the rhomboids help to keep the scapula pinned down to the rib cage so that we don't see that medial border pop off, which is commonly known as winging. So it attaches to the medial border. So actually, maybe we might be able to see it from here. If I take off rhomboids, take off serratus posterior superior, and then this is your serratus anterior, right? So we can see it from both angles, right? It's going all the way through and attaching to that medial border. So let's hide that. And then what we'll see is that we just see ribs and your scapula floating on top of your rib cage. Again, it's not completely floating. All of that empty space would be filled with muscles pinning down your scapula to the rib cage. So that is one of the key points that I want to emphasize is our scapula, it's not a true joint. There's no passive support or ligaments supporting our scapula bone to bone connections. It's just purely supported by dynamic stability, all muscular support. All right, so now let's dive into the muscles. And I know I mentioned a bunch of them already, but key muscles of this kind of shoulder girdle region, you see subclavius here. And this is not always the easiest to find in a real body because it's just like what the name implies, it's underneath the clavicle. So it's typically really deep and it's going to sit on this inferior surface of the clavicle. But again, it's not a big muscle, but it does have some action on the clavicle and helps to stabilize the clavicle and resist upper extremity movement and resist, of course, any stress or excessive stress to the SC joint. So that's your subclavius. Then as I showed you, serratus anterior, we won't go into that, but it's a key muscle to stabilize the scap, protract and upwardly rotate. And that is something functionally, especially with overhead movements, the serratus anterior is playing a large role to help to stabilize the shoulder blade. Some key clinical points here that we learn, through athletic training curriculum, and I'm sure many other professions. You have your long thoracic nerve that's crossing right over your serratus anterior. I know I hid the serratus anterior, but it crosses right over it. And it's sitting relatively superficial. So anytime you have damage in this region, an injury, or we learned during surgery, this can be damaged. And since the long thoracic nerve supplies serratus anterior, that's when you can see some nerve deficit and motor deficits with a winging scapula. So it's just something to be aware of. So that is your serratus anterior muscle. And then other muscles that you would consider shoulder girdle muscles, because it attaches from somewhere in the axial skeleton to the scapula, would be pec minor, right? So this is going to be attaching, and it's deeper, sits underneath pectoralis major, but pectoralis minor, it typically starts from the 3rd to 5th ribs, but that can be varied a lot depending on individual variability. But for the most part, starts from a few ribs to the coracoid process, which we see here. And the coracoid process is this projection coming off of your scapula, and that has some muscular attachment points, which also makes it a point at risk for tension from different lines of pull that could create some stress and irritation. But just know that pectoralis minor is one of the muscles that attach to your coracoid process. The rest of the muscles we kind of covered in the back, right? We have like levator scap, we have rhomboids, but collectively those are the big players that help to stabilize the scapula so that we can move through our shoulder joint and we can do all these upper extremity movements. So now let's go back and backtrack and identify the bigger players of what we think when we think about upper extremity movements. So again, this is platysma. Let's get rid of that. It's a very superficial muscle. And then you're going to see, of course, deltoids. So deltoids attaching in this horseshoe-like fashion. Well, actually, let me show you the whole thing here. So trapezius, let's take that away. This is your spine of the scap, acromion process, and then your clavicle. So your deltoid, it attaches in this horseshoe area, which is the lateral third of the clavicle, your acromion process or AC joint, and on the spine of the scapula. So this is where your deltoid, which is one of the big muscles that helps us to move our shoulder in all different fashions. The anterior delt gets work a lot with any type of pushing motion out in front of us. Overhead pressing will get more of the deltoid in the lateral deltoid region. Lateral deltoid, anything out to the side, raising our arm up to the side, pressing motions overhead as well. And posterior deltoid is anything that we're either horizontally abducting our arm or pulling things or extending our arm past our neutral position. That will be your posterior deltoid. So again, these muscles are very big. One thing that I want to point out, let me undo this, is that your deltoid tuberosity is farther down than you think. So let's take away the biceps brachii and let's expose some of the bone, brachialis muscle, and you're seeing the bone now. So your deltoid tuberosity, intuitively, I think we don't understand how low our deltoid attaches to our humerus, which is why it has good force producing capability for relatively, the muscle is not as big as your big girthy muscles like your quad, right? But it does produce a decent amount of force because of this relatively lower attachment on our humerus. So that's your deltoid tuberosity. So that is your deltoid muscle. Let's hide that. What you're going to see underneath the deltoid is where these muscles are attaching to your humerus. So we have your pec major, right? And your pec major, it technically, all the books will say that it attaches to the lateral lip of the bicipital groove or intertubercular groove. And then you'll have the lat, which attaches to the medial lip of the intertubercular groove or bicipital groove, which if I highlight this here and spin it around, you can see that's your lat, and most of the models will have it pretty accurate on that medial lip of this is your bicipital groove where your long head of the biceps tendon will pass through. So you can see the lat is right there. So let's hide the lats. And then I already went over pec minor, so we won't go over that. This is coracobrachialis right here, which does contribute to some of the shoulder flexion just based off of its origin and insertion. Okay, and just for the purposes of this, I'm going to take away triceps. So I'm going to take away all of your triceps so that we just see a clean model of the shoulder. So those are the bigger shoulder muscles. We hit all of those. And now let's break down the rotator cuff. So rotator cuff, it's a very key muscle group of the shoulder to provide that dynamic stability again. And the big thing about the rotator cuff is, yes, it has isolated muscle function, but it's very important to understand its functional role. And its functional role is not to produce isolated muscle action. One, it collectively works to keep the humeral head in a safe and good congruent position with the glenoid fossa so that the arthrokinematics of the joint can stay in a healthy range without slamming up into our acromion or without dislocating anteriorly or inferiorly. And two, its main role, and this is how it's always been emphasized to me, is to really slow down the opposite action, especially when we talk about overhead athletes or any forceful type of upper extremity movement. What we're doing is that when we're throwing a ball, as soon as we need to kick on the brakes to slow our arm, what's happening is that the external rotators of the rotator cuff, they are slamming on the brakes to prevent excessive internal rotation of our humerus. So what I mean by that is, as soon as you release the ball, your arm is rapidly going into internal rotation. And in order to stop our arm safely and prevent our joint from just dislocating out of the socket or other bad things to happen, we get injured every time that we throw, our external rotators of the rotator cuff need to slam on the brakes to slow our arm's internal rotation, right? So it has that opposing role. That's the rotator cuff's main function. Now, also, whenever we're doing overhead types of lifts or movements, that's a lot more demanding on our rotator cuff. Anytime we lose some of the passive stability and support just based off of position alone, but also under heavier and heavier loads, our rotator cuff typically has to work overtime to make sure that it's keeping our shoulder joint, our glenohumeral joint, in a safe position so that we can use our bigger muscles to produce force. So that is collectively what the role of the rotator cuff is. Now, our rotator cuff is made up of 4 muscles, and for any of you that have been studying human anatomy or musculoskeletal anatomy, you'll be exposed to the acronym SITS. And that is very accurate, but I think if you understand and break down the role of each muscle, it'll also be just as easy to remember. So SITS, first muscle is supraspinatus, and it's just purely named on the location where this muscle is. So supra is above, this is the spine of the scapula, it's above the spine of the scapula, so that is why it's called supraspinatus. And you can see right here, it sits actually and fills up the entire supraspinous fossa, and it is going to travel in this thin space, your subacromial space, and attach on more or less the superior aspect of your humeral head. So that is where the supraspinatus will sit. So that is supraspinatus. Then you're going to have infraspinatus, infra below the spine of the scapula. So therefore infraspinatus. And this comes and attaches to the posterior aspect of your humeral head. And that is going to be one of the strong external rotators of the rotator cuff group. But again, it functions or works extremely hard to slow down and decelerate your arm, especially with throwing or overhead athletics. Then how I always remember this is that you're going to have your teres minor, which is one of the rotator cuff muscles that does external rotation. This is your teres minor right here. And you can see that it's just an extension of the infraspinatus muscle, and it pretty much follows the exact same pathway. So that is your teres minor. Now, for those of you that it gets confusing because there is a teres major, how I always remember teres major is that it's like a small latissimus dorsi muscle. It pretty much follows the similar path, and it attaches to the front side of the humerus, and it acts as a small latissimus dorsi muscle. If latissimus dorsi had a major and a minor, teres major would be the equivalent to latissimus dorsi minor. Now, don't get confused because that doesn't exist, but that's also another way that it always reminds me that teres major is not one of the rotator cuff muscles. It acts in conjunction with latissimus dorsi. So anyway, I digress. Let's get back to the rotator cuff muscles. So those are the muscles on the back side of the scapula, and then you have a muscle on the anterior side of the scapula, which is called your subscapularis. So sub, below, because we're on the anterior side of your scapula, and this is going to come through and attach to the anterior side of your humeral head. So that's your subscapularis. Now collectively, they don't look as differentiated as this might. You can differentiate it, and you can see where kind of the muscle tends to have a subtle division, but really the rotator cuff functions as a group, and it really all blends into a single tendon around the humeral head. And again, its job is to collectively hold and keep the humeral head moving, sliding, gliding, rolling in the glenoid fossa with all of the different movements and ranges of motion that we can create with our shoulder joint, and also to make sure that we keep that dynamic stability under faster velocities, under conditions that require more force production, and basically keeps our glenohumeral joint moving safely so that our bigger muscles, the ones that we talked about like our pecs, our lats, those muscles, our delts, can do what it needs to do and produce more force. So our rotator cuff plays a critical part in making sure that our shoulder joint can produce all the force that it needs to. And overall, that is pretty much the main muscles of the shoulder joint, and I will continue down the arm in the next video, but you can take a look at that. And that is the shoulder girdle and the shoulder joint, or the glenohumeral joint, and some of the key players in this region.